Hello, everybody. Welcome to the Focus Group podcast. I'm Sarah Longwell, publisher of The Bulwark, and today we are talking about COVID. Remember COVID? It's the virus that has consumed our lives for the last 2 years. And in those 2 years, it has been a staple of focus group discussions, often the number one concern of voters, though perspectives on COVID were deeply polarized by political affiliation. But lately, COVID has receded somewhat. With the invasion of Ukraine and domestic inflation fears, voters have clearly moved on in terms of what is top of mind. And for the past couple of months, there's been this growing consensus across the focus group participants, regardless of political party, that we're going to have to learn how to live with COVID without significantly altering our lives. So today, we're going to hear clips from focus groups gathered over the last 2 months from voters across the political spectrum, as well as groups of voters under 30. Some of these interviews were during the height of Omicron, and others were more recent. And it's interesting to hear how much feelings have changed, even just in the past couple months as we've seen Omicron recede. So our guest today, which I am incredibly excited about, is Dr. Leana Wen, emergency physician, former Baltimore Health Commissioner, CNN medical analyst, and Washington Post contributing columnist. She has lived on the front lines of public health, leading the fight against the opioid epidemic, outbreaks of infectious disease, maternal and infant mortality, and COVID-19 disinformation. You see her all the time on TV. You read her in the Post. Dr. Wen, thank you so much for joining us.
Thank you, Sarah. It's a pleasure to join you.
Okay, so just level set for us before we even dive into these groups. Where are we right now in this pandemic? How should a well-adjusted human be thinking about COVID right now?
I think there are two ways to think about where we are. One is, what is it that individuals should understand about our own risk and what we can do? And the other is, what should government's responsibilities continue to be? Individuals who are fully vaccinated, and especially if they are boosted, are at very low risk for severe illness due to the coronavirus. And so it's extremely reasonable for mandates to be lifted and for people who wish to resume their pre-pandemic activities, understanding that there may be another wave that might come, there may be a new variant that arises, and we may need to change our behavior in the future. But right now, as we're speaking, the infection rate is actually very low. And if it's any time to lift restrictions and return to that pre-pandemic normalcy that we also crave, now is the time to do that. But that doesn't mean that the government should stop paying attention. And so I'm very concerned that as people return back to normal, there is this sense that COVID is over, when actually the pandemic is not, the public health emergency actually is not. And there needs to be a lot more done to make sure that we have antiviral treatments available. We have booster shots. We have testing so that we don't have to ramp up testing all over again if there's a surge. The government should be doing all these things in preparation while letting people know that of all times, this is the time to go back to the things that they have missed so much.
It's a perfect segue into this first group. So we recently talked to this group of Republicans that voted for Biden, your typical swing voter. And here's what they said about how they were feeling. And this one was very recently. It was just a week or two ago. Here's how they're feeling about COVID.
I'm much more relaxed as a person. I'm not as afraid of it as I was in the beginning, but I don't think that Omicron is the last variant that is going to spook the world. I think that there probably will be more. So I just think we're like in a sweet spot right now.
I think that we will have some other variant pop up that will cause alarm. But I do think that more and more people are getting vaccinated and boosted. And so that helps.
I wear masks in grocery stores, and I'm one of the few out here who I see is doing it, but I'm still going to continue to do it until I know this thing is at zero or close to it.
So you can hear the uncertainty in these answers. You know, these voters they're feeling better, but they're not totally sure that we can really, move on. And so with COVID surging again in Europe, China, and South Korea, are people right to feel like this is just a temporary reprieve?
Yeah, so it's interesting, Sarah, because when I heard those clips and heard that interview, I didn't get uncertainty from those individuals. I actually got a very good sense that they know where we are. Actually, I agreed with everything that these people just said, which is that we have this relative lull right now. And we should enjoy this period while we can, understanding that this may not last. And especially as you mentioned, we are now seeing increases in infections in Europe. We're seeing lockdowns in China. There are places where variants could very well arise because of high infection rates. And there could be something coming our way. But that isn't uncertainty. That to me is an acknowledgement of the reality of where we are going forward, which is that there probably are going to be these periods where we don't have a lot of infection. Restrictions should be lifted then. And then if there are new variants that arise, we may need to change our behaviors accordingly. I think this actually is a reflection of just the state of COVID, as in, I think of this as a weather forecast. When there is rain or when it's really cold outside, you have to wear different protective layers than you would than if it's a nice day. I think that's how we're going to have to view COVID going forward, that there's a lot of nuance involved. And I do think that it's time for us to shift to individual choice.
You know, what's interesting about swing voters is sometimes they tend to be the most tuned in. So I get it that you think that they've got their finger on the pulse. But let's turn to young voters, because one of the things that I've been arguing for a while, going back before the somewhat shocking elections in Virginia and New Jersey, is that politicians, especially Democratic politicians, were underestimating how much COVID fatigue there was among voters, especially young voters. And I know that you as a doctor are not thinking about the political implications of this, but just listen to how these young voters talk about where they are on COVID.
I'm just so over this. I was over it when it started.
And my big thing was COVID. I think it's becoming ridiculous at this point. Trust the science just drives me nuts. So stop.
Okay, you might expect those kinds of statements. Those are young Republicans, but here are the Democrats.
I'm very unhappy with the way things are going, and COVID is the worst that it's ever been, and the government is doing basically nothing about it. I mean, nothing else has really changed, so I'm very disappointed.
It just seems like things are super bleak right now with the pandemic just continues to be at the same point we were at last year around this time, or I guess we're in 2022, so over a year ago. And so it's just kind of hard to seem hopeful at this point.
And look, COVID's been hard on everyone, but in some ways I've always kind of felt the worst for younger people, you know, teenagers, college kids who are missing some of life's major experiences and milestones. And there was a guy in one of these focus groups, he was a doctor, and he said something like, it made sense to shut down when we didn't know anything, but as soon as we realized that COVID was disproportionately dangerous for older and sick people, but not young, healthy people, we should have changed our approach. Do you agree with that? You know, should we just let young people live their lives or no?
Yeah, it's really interesting because listening to the focus groups, what struck me so much is that people have very different realities. There are the individuals who are young and pretty healthy and vaccinated and boosted who still think that there is great risk to them, even though there isn't. And then there are a lot of other people who probably are quite vulnerable, who are saying that even at the beginning of the pandemic, that there were too many restrictions put into place. I think one thing that we have to keep in mind is this concept of change, that we have seen the evolution of COVID through the course of we're now entering year 3 of this pandemic. And so something that's true now wasn't necessarily true 2 years ago or even a year ago. As in at the beginning of the pandemic, we didn't know exactly what was going to happen. We had plenty of young, healthy people who got sick and died. And so to say that, well, if you're young and healthy, just do whatever you want, that's not appropriate at the beginning of the pandemic. But now we have vaccines that work extremely well. We also know about one-way masking, the concept that if you are wearing a high-quality mask yourself, an N95, K95, KF94 mask, you are very well protected, even if others around you are not consistently masking. And we also now know that Omicron, our dominant variant, is a milder variant than previous iterations. And so the combination of that makes it such that right now, I think it's true that if you're young and healthy, you should go about doing your normal life. And really, for you, COVID may not exist as an existential threat. But if you are immunocompromised and if you're elderly, you should still be hunkering down. I think that's true now. Was it true at the beginning of the pandemic? Certainly not. Was it even true a year ago? I don't think so either, because at that time, the vaccination rate was so low. We didn't have vaccines available for children, and we had a worse variant than we do now. And so, what that physician said, I partially agree with, but only when it's applied to where we are now, not where we were a year ago, and certainly not where we were 2 years ago.
I'm glad you brought up the vaccines. Let's talk about vaccines, because ever since we've gotten the vaccines, especially in the Republican groups, often in the younger people groups, the amount of misinformation that you hear about the vaccines is catastrophic. Lots of mostly GOP voters talk about things like listening to what Candace Owens says about the vaccines. But there's also like a recurring theme where people have kind of like a do-it-yourself approach to how they get vaccinated, how many shots, when to get boosted. And it's not entirely relegated to sort of the MAGA or Republican groups. I mean, it happens among Democrats too, but let's listen to a GOP group first.
I mean, I got the one and I feel like that was good. I don't necessarily know if I need to get a second, but I might. I don't know. It just kind of depends. I'm not opposed to it, but I really just don't want to do too much that I don't necessarily need to.
So my biggest problems, number one is COVID. Again, I think there's just not enough science out there about what's going on with these vaccines, the long-term and short-term effects. So you just kind of have to let people do what they want to do.
Yeah, it's an option. I'm not saying I won't get vaccinated ever. I think maybe next month, maybe in a year, maybe never, but I guess I don't see the rush of doing it right now.
As far as that next booster coming up, I know 3 people right now that had the 2 shots and the booster and are sick as a dog. But I'm not understanding that if these boosters are supposed to help us and not make it worse, no, it's bad.
That last voter was actually a Democrat. So, we hear so much skepticism about the science from voters. It can be a little scary to hear how little people trust the medical community on issues like vaccines. I mean, it's not like these focus groups were right after the vaccines came out. They were all within the last month or two. And so vaccines have been around for a while. Where do you think all this misinformation comes from? Is it the junk being put out by people like Tucker Carlson's or Joe Rogan? And how do you, I know you're an expert on misinformation, how do you think about the information that's getting to people around the vaccines?
Yeah, it's interesting because as I was listening to this focus group, I felt like I was listening to my patients, because I have many patients who are still unvaccinated, who would not consider themselves to be anti-vax. I know there are some people in the focus groups who identified as such, but actually a lot of people who have doubts or concerns about the vaccines are not anti-vax in general or anti-science, but they have some misunderstandings. And I think that misunderstanding, yes, it comes from active disinformation that's being put out by actors who have other motives at hand. But I think that I just was struck by this overwhelming sense that I wanted to talk to these individuals, as in they have real concerns that are best addressed in a one-on-one conversation, which is what I do with my patients. I mean, I have plenty of patients who don't understand why it is that people can be vaccinated but still get sick. And then I have to talk about, well, what if they did not get vaccinated? How much sicker would they have been? Or individuals who are concerned about long-term consequences. And what I would talk to them about is, what about the long-term consequences of COVID? And the fact that we actually now have so much data from hundreds of millions of people who have gotten these vaccines and don't have long-term consequences, right? I mean, all these are reasonable concerns. We may not agree with them, and maybe because of bad actors and misinformation, that's why people have these concerns, but they are legitimate. And so validating these concerns, talking to individuals, that's how we overcome that vaccine hesitancy. 2 other things I wanted to mention here. One is that a number of people talked about how they got vaccinated because of mandates, that they had to get vaccinated in order to keep their work or to go to university because it's required. And I actually think that that's proof that mandates do work, that there are a lot of people in that middle group, if you will, who actually aren't that opposed to getting vaccinated and who are not going to fight it, but they need that additional push. And maybe some people even need to be able to say, oh, I wasn't going to get vaccinated, but, because maybe their social circle, many people are against vaccination. But maybe if they can blame somebody else and say, well, I had to get vaccinated because it was necessary for my college, that's a way out for them. Another thing, too, is you were talking, Sarah, about the importance of having this do-it-yourself approach, if you will, which I actually think is a good thing. because I do think that we should be personalizing recommendations to the individual. Somebody, for example, who got one dose of the vaccine but then got COVID, do they really need to get another dose right now? That's an open question. Or what about somebody who was fully vaccinated and then got COVID? Do they still need to get a booster? I don't know that they do. And so I actually think that this one size fits all approach it's turned a lot of people off because they know their own bodies and they are looking at the science themselves and seeing that a personalized approach, which again is why I wish that I could have one-on-one conversations with these individuals. I think we could come to a much better place when it comes to their acceptance of the vaccine for them.
Wow, that's such an interesting answer. I got to tell you, though, I deeply sympathize with the idea of wanting to break the fourth wall and like just jump in and talk to people. I mean, I do these groups a lot, and when I moderate, you never inject anything into them because you're just trying to listen. But yes, there is often that desire to talk to them, have a conversation. But you're totally right about the mandates. I mean, I hear this come up in focus groups all the time, especially that social pressure, social circle one. I remember a woman who said, because especially in the beginning, in the Republican groups, people would get we'd always ask, are you vaccinated or are you not vaccinated? And if people were, they would feel like they needed to justify themselves. I remember a woman who said, well, I only got it because it was required for a cruise that I was going on. And it was almost like she felt the need to justify her decision. And so I think you're completely right about that. All right, we're just going to take a quick break here and we'll be right back.
So do you ever listen to a Bulwark podcast but wish you could also weigh in with your comments or your questions? Join us for Thursday Night Bulwark. Every Thursday at 8 o'clock Eastern Time, join a rotating cast of Bulwarkers on Zoom to talk about the day's news or go deeper on topics that don't get their due in the fast-paced news cycle. Political news today is a lot of things, but it is not boring. And our team is here to help you make sense of it all. Thursday Night Bulwark is only available to Bulwark Plus subscribers, so join us at plus.thebulwark.com.
And we're back. I do want to stay on this theme about where people's trust is. One of the things that we asked about was the CDC. And, there was evident frustration about the CDC's handling of the pandemic, even by those who, I'm just going to say, quote unquote, trust the science. I would say it's been very consistent across groups that people feel like they don't know where to turn for clear guidance. Here are some of the swing voters talking about the CDC.
I trust the CDC in general. I think their communication strategy throughout this has been absolutely abysmal, changing the recommendations virtually on a day-to-day basis. Sure, absolutely trust the science, but we're going to change it from 6 feet to 10 feet, from 10 feet to 3 feet, not on a whim necessarily, but it seems like a lot of the times that they've had updates that it almost created some of this mistrust in the government systems that we have in place.
I think their communication has not been effective. My mom worked at a hospital in Chicago, and she would constantly tell me in Chicago, it was always mask mandates. In Phoenix, there are some for 2 months. It's hard to know who to go by, what to say. Recently went to Disney World. Me and my husband were the only ones in masks. So I just feel like there's not a concrete set of rules that we all can kind of follow. Just wanting to have a more united front to combat it, I guess.
They're the ultimate purveyor of science. And I do respect what they are offering. And I just wish those channels of communication offered enough articulate detail about what's going on. And so people are enriched and empowered to make the final call on whether or not to participate.
So that is the swing voter group again. But I got to tell you, as I've done these groups over the last year or so, you get this all the time. Just people so angrier than these swing voters, especially in the GOP groups, where they just are like, everybody changes their mind all the time. And you can't get any consistent guidance. And what are they even telling us? And I know you said earlier when we were talking, obviously we've learned more. And so, it's not fair for people to say, well, see, things that are true now, they should have known 2 years ago. But what do you make of just I don't know that there's anything to say other than that the CDC's credibility has been damaged in the eyes of the public over the course of the pandemic. Or do you think that's not true?
Oh, no, I absolutely think that that's true. And it's a major problem because public health hinges on public trust. When you want people to do things that are uncomfortable, that they don't want to do, like staying in quarantine or avoid seeing their friends and family and not go to restaurants or wear masks or whatever it is, you need people to believe you. And that depends on trust. And I actually am really worried because people equate the CDC with public health. And so if the CDC is losing credibility, then public health as a whole is losing credibility, and we may have major problems should another public health crisis hit us in the near future. So I think part of the issue is that the CDC has not done nearly a good enough job of explaining why changes are being made. I actually think that most Americans understand that change is to be expected. I mean, we see change in medicine, right? If you're undergoing chemotherapy for your cancer, you would expect that if there's a new treatment that comes out, that your doctor's going to explain to you what that new treatment is and give you that option. I mean, we understand that change happens, but we also expect that there's some kind of explanation that comes with the change. And I think here's where the CDC has really faltered. So for example, take their change in isolation guidelines from 10 days to 5 days. And then after 5 days, you have to wear a mask. I mean, first of all, the whole thing is confusing. I think people just misunderstood that to be changing 10 days to 5 days. But I think the science actually really didn't change. And I think it would have helped a lot if the CDC had said, hey, at this point in the pandemic, people just are not going to isolate for 10 days. Also, we're facing a critical shortage of healthcare workers, and we can't afford for employees to be out of work for so long. So it's because of the reality that we're changing from 10 days to 5 days. I think that would be a lot clearer than simply, okay, well, maybe the science changed, maybe it didn't, but we're just changing this guideline. And so I think that one of the issues too, and here I think this is my advice for the Biden administration and for other administrations going forward, is that they really need to understand that follow the science as a mantra is not sufficient. That yes, it is true that we have to listen to the science, but so much of the determinations of policy, it's a judgment, it's a trade-off. How long to keep on masks is not just about listening to one study. There isn't going to be a study that tells you that. But so much is based on trade-offs. What is the benefit of masks? What are the downsides of masks? What are the benefits of keeping restaurants closed? What are the downsides? And I think that's where I hear a lot of frustration from people in the focus group is they don't know how decisions are being made. And they're being told to follow the science as if there's some kind of elusive God that's saying, here's the ultimate study. And then people are either listening to it or not. But there's no such clarity. And I think it's in that gray zone that an explanation of individual choices and what people should be doing for their own lives, how that could be really empowering. And that part has been missing.
Well, just on this point, I'm curious, what do you think about the mask guidance as it stands right now? Like, obviously, we're seeing masks mandates being dropped across most cities. Schools are now starting to drop them, which I think is, there's a lot of parents desperate for their kids to take off masks. And then there's other parents who are really nervous about losing masks in schools. Where do you think we should be on masking right now?
I think masks should be optional across the US. I think people who choose to wear masks should be able to do so and not be made fun of, not be bullied. They can have all kinds of reasons as to why. Maybe they are immunocompromised. Maybe they live at home with somebody who has chronic medical illnesses. Maybe they have an unvaccinated young child that they want to shield from COVID. I mean, whatever the reason is their own choice. Or maybe they don't want to get COVID because they fear long COVID. Whatever the reason is, do that. And now, again, we know about one-way masking. That protects you very well if you wear a high quality mask. So do that. But I do not think that masks should be required for two main reasons. One is that masks for so many people symbolize the pandemic. And masks have unfortunately become so politicized and such a polarizing issue that I think the longer we keep on masks, the more we lose the public trust about mitigation measures. So many people, as we see in the focus group, do not think that COVID is an issue anymore. And so if you keep saying you have to wear masks, that goes against their understanding of where we are, and we're losing public trust every time we're trying to impose something on them that they don't want to do. The other reason is masks are a mitigation measure. that just like every single medical therapy has benefits and downsides. And we need to be intellectually honest and acknowledge that. Okay, there's not much downside to me as an adult wearing a mask in a grocery store. But my 4-year-old going to preschool and in perpetuity wearing a mask, that could impact his language development, his emotional development, his cognitive development. I mean, we have to be intellectually honest and say two things can be true at once. Masks can be useful and are useful to reduce virus transmission. That's the benefit. But there is a real downside, especially in children. And again, I think this is where so much of the rhetoric has been lost, that mainly Democrats have been basically saying we need a mask in perpetuity without recognizing the downside. And maybe Republicans are saying masks should never be used. I mean, the truth is somewhere in between. And we need to allow for that nuanced conversation to occur.
Yeah, I mean, I don't know if anybody out there's got young children, but if you do, I mean, when I take off my 3-year-old's masks, like it is sopping wet. It's so gross. You know, these poor little kids just like drooling into their masks. You make a really interesting point about the public trust and how we keep it. And one of the things that's interesting to watch is the evolution of the way people have felt about Dr. Fauci in particular. He was this like emblem early on. I would hear how much people loved him in the focus groups, including in many of the Republican focus groups. And now this is how Trump voters talk about Dr. Fauci today.
Dead or alive.
I mean, we don't close the country down during flu season. The only reason we had to do it this time is because Fauci constructed this Chinese flu to infect the world to be, just continued mayhem.
Obviously, some unkind words about Dr. Fauci, but you're somebody who's been like a public doctor during COVID. You try to help people make sense of this. And people like Dr. Fauci, people like you, people like Dr. Jha from Harvard have become sort of critically important to the public, trying to have a direct line to doctors who can explain what's going on to them. I mean, how do you think about your role as kind of a public doctor? And what do you make of the way that the public has kind of shifted on Dr. Fauci, who maybe was like the most emblematic of these public doctors?
Yeah, it's interesting because I think what Dr. Fauci has been able to do that other people in the administration have not been able to is to give personalized information that people can use in their daily lives. So many others in the administration, and understandably so, I mean, both within the Trump and the Biden administrations, they're towing the line. They're saying, here's the policy, right? Here's what the CDC is saying, but they're not necessarily then following that up with, well, here's how you should interpret that for your life. That's what I see as my role in answer to your first question, which is that I don't work for the government. I know what it's like to work for the government and how you can't stray outside your box. But my role is as a doctor. So I talk to the public the way that I would talk to an individual patient, as in, given what we know, here's how you can think about making decisions for your life. It's not realistic to expect that people just are not going to see people or to see their loved ones in perpetuity. So how do you make things safer? How do you weigh your own risks and benefits? I mean, I think that's what I've seen my role to be in the same way that I would be speaking to my patients. Dr. Fauci, though, is in a very different position because he is seen to be the mouthpiece for the administration. He was really cast into this very negative light during the Trump administration, and that's carried through in the Biden administration so that he is now emblematic, wrongly, but he's emblematic of lockdowns or restrictions or things that people don't like about the pandemic. I mean, I think it's the classic example of shooting the messenger, if you will. And he has had so many death threats to him and to his family. I mean, all of that is extremely upsetting. What I will say, too, is that listening to the focus groups, what struck me perhaps the most is that masks and vaccines seem to mean something other than what they are to both the Democrats and Republicans, if you will. And this is obviously not every Democrat and every Republican, but just it seems like there are two groups that are at a very significant extreme when it comes to understanding masks and vaccines. To one group, masks and vaccines are understood as control, that somehow it's the government trying to control you by making you do something that you don't want to do. And then by the other group, they understand this as respect. As in, you do this, you mask to protect others, you get the vaccine to protect others, that it's a sign of respect. When actually, I think another way to see both masks and vaccines are it's a way for you to protect yourself and the people you love around you. And so it's interesting to me that this scientific intervention, just as we have interventions for controlling your blood pressure, your diabetes, or treat your cancer or something else, it's understood as control or respect, something other than what they actually are.
This is such an important point, and you may have noticed, but we live in kind of a tough timeline where literally everything is politicized. And so when you do a lot of these groups and you talk to Democrats, you talk to Republicans, they live in different worlds when it comes to COVID, and they have for a long time. I mean, early on in the pandemic, you could really hear everybody kind of experiencing it in the same way, which was in a hard way. But at some point, and I think it probably has a lot to do with President Trump, Republicans decided we're out on this. Like, this isn't a real thing. It's the flu. We're not participating. And Democrats went far the other way, and it's been politicized ever since. And that's been a real tragedy for the country. And actually, speaking of Donald Trump, I just want to play for you because we have asked people kind of all along how they think Trump did with COVID. And let's listen to both some Trump voters and some Democratic voters.
As best as he could, because it was such a foreign thing happening in our lifetime.
I think he did a great job with that. I think that was what needed to be done. And I think that's what a business guy does.
Yeah, did a good job, except for hiring Fauci.
Yes, I agree with that.
No question. Trump is responsible. Came out, called it a hoax, wasn't wearing his mask around his own staff. I remember when Ebola first came out, and we actually had a case of Ebola here in North Dallas. I never had any concern that I was ever going to catch Ebola or be near anybody because it was taken care of. They got the person into the hospital, they treated them, they contained the virus. I mean, it's just Trump. It ought to be called the Trump virus.
His approach was like, this is fake. This is not real. This is something that everyone is making up. And then you're seeing people dying left and right. So I don't like how he handled it. Now, once he finally realized that it was real, and then he started implementing the vaccine and things of that nature to trying to kind of help with that, then that's a different story.
So, I mean, you can just hear it clear as day. Republicans think Trump did an excellent job. Democrats think he did a horrible job. What do you think, looking back, how do you think COVID was handled? Do you think things would have gone differently if we'd handled it differently from the beginning?
Yes. Although I also want to qualify that and say that it is very difficult for us to look back and say, at what point could the intervention have been different? As in, we know so much more that we do now compared to before. So I think at the very beginning of the pandemic, when the issue was lack of testing, I don't know that that was something that you could specifically blame on Trump. Or even a couple months in, you could still say, well, we didn't know how bad this was going to get. And so his whole push to reopen, somebody else who was reasonable might have also pushed in that direction as well. But I do think that over time, there were numerous things where he directly went against the advice of public health experts, also made things really confusing. I mean, we talked about miscommunication and mixed messaging. That very much was driven by the president himself. And I think that certainly contributed to the polarization that we're seeing. And I think the backlash that you mentioned, I mean, I think part of what happened is a lot of Republicans who followed the path of President Trump in basically not acknowledging that COVID is a real issue. And Democrats went the opposite extreme, even to the point that many people still cannot seem to let go of masking, even though we have really low levels of COVID. And so I think we're in this extremely polarized position where there are two extraordinary extremes, right? People who talk about COVID in the past tense and don't even think that it was real to begin with, and others who, even though they are vaccinated and boosted, cannot go about their daily lives. I actually think that most of the country is in the middle, and as with basically every other issue, feel left out and feel as if they're confused and they're, shouted at for just trying to live their lives.
Let's talk about Biden for just a second. I think that some Democrats in these groups, just as exactly to your point, they think that Biden should be pushing harder to end it. But the Republicans, to some degree, especially early on, they were actually giving Biden some credit for handling it well. Lately, it's been less so. But let's listen to some voters talk about how they think Biden's doing.
He's trying, but he's not pushing forward enough. I feel like he needs to come with a little bit more. You know what I mean? Especially with the vaccines and the masks and stuff like that. We need to get this over with. We need to figure out what's going on and really handle something with this. There's got to be some way to really control this. You're willing to push it forward.
In terms of how I would rank it, I'd say probably a B minus C. But my biggest issue is less of what he has been able to do than what the divided country has allowed us to be able to do. And yes, he thought he could solve the pandemic, but then you've got all these people who are unvaccinated and you've got all these other strains coming. So it's a tougher nut to crack, I think, than anybody thought. But I would say that most of the issue is the inability to move forward because of the divisions that we have.
He came in on his horse promising to solve the COVID issues. I know that's virtually impossible, but I don't know what he's done.
Do you think that Biden overpromised in terms of what he thought he could do on COVID?
You know, I wrote a column last month, I think it was maybe 2 months ago, where I said that the biggest problem right now with the Biden administration is that it's really unclear what is their goal. I don't actually think it's overpromising in the beginning because things change, right? When at the time that Biden came into office, the main goal was getting vaccines out. He delivered and did that exceptionally well. But then the question is, what's next? What is our goal? As in, I think there are two paths for the US. One path is to continue trying to reduce the level of the virus, trying to control infection, making sure that we're still doing contact tracing and isolation and quarantine, basically trying to suppress the level of COVID, even if we're not aiming for a zero COVID strategy. The other is fully saying we're going to live with the virus. We don't care what the infection level is, as long as our hospitals are not overwhelmed and as long as vaccines continue to protect us well against new variants. Who cares if the infection is out there? We don't need to keep people home, even if they're infected, because we should be treating this just as we treat colds or at worst the flu. We don't make kids quarantine and isolate for 10 days if they have the flu. And so I think it's not clear as to where we are. South Korea, Germany, the UK have basically come out and said, even though we have escalating cases, we don't care. We want people to live and we see COVID like the flu. I wish the Biden administration would come out and say that because their policies are basically going in that direction. But because they haven't articulated it, there are a lot of people, including his own supporters, who are saying, hey, you're not doing enough because they think he is trying to do path number one. They think he's trying to control COVID, which he's not really, and we're not succeeding at that. That's why they think he's failing. And on the other hand, if he said, we're actually doing path number two and we're trying to let people live, I think a lot of Republicans would be really happy to hear that. They might say, oh, he should have listened to us sooner. But I think they would agree with that path. And so I think just articulating where we are and being bold and taking a stance, because that's really where he is anyway. So just say it. And I think the country will come along with him.
I'll tell you, anybody who listens to this podcast knows that the number one critique of Biden these days, especially coming from these focus groups, is that he doesn't come out and just say things enough and people don't know clearly where he stands. Okay, one very last question before I let you go. Personal privilege. You and I, we both have young kids. What are we supposed to do about kids under 5 in terms of, is there a vaccine that's going to come out? And if it doesn't, how concerned should we be about young kids? Because I know a lot of the studies show that they're not nearly as susceptible, obviously as older, sicker people. So how should we be thinking about young kids who can't be vaccinated yet?
It's really hard. And this is another one where we need to give people information and then let families make the best decision for themselves. So I have 2 little kids under 5. I mentioned my 4-year-old earlier. I also have another baby, my pandemic baby, who was born in April of 2020 and so is about to turn 2.
Congratulations.
Thank you. But we, for almost 2 years, were extremely careful with our kids, initially because I had an infant, but also because I just didn't want to take the risk, right? We just didn't know what was the impact on young children. I thought, look, let's try to hold out until there's a vaccine available for them. I was really hoping that we might have a vaccine by the end of last year, and I thought we could hold out for that long. But of course, now we know that there isn't a vaccine clearly on the horizon. The earliest that we may be able to have one for kids under 5 or 6 months to 5 years old is maybe next month. And that would be a 3-dose vaccine by Pfizer. Moderna also has another vaccine under development. We should have results for that 2-dose vaccine probably in that same time period. But when you think about how long it's going to take for kids to then be fully vaccinated, for a 3-dose vaccine that's authorized next month, I mean, we're looking at the summer. And so that's a long time to wait. And actually, the decision that my family has made is that now that cases are substantially declining, where we live here in Maryland, we know that Omicron is a milder variant than Delta, although it has still resulted in a number of hospitalizations among children, including young kids. But we also have decided that the risk of keeping, or the downside of keeping our son, our 4-year-old in particular, isolated is not worth the potential benefit of shielding him from COVID. And so we recently just decided 2 weeks ago, when the indoor mask mandate was lifted here in Baltimore City, where I live, that we were going to send him to school without a mask. I just enrolled him this week in spring break camp, where he's around dozens and dozens of other kids who are also without masks indoors. And, you know, it's something that I think about a lot. I know that other families will be making a different decision, especially if they have other people living in their household who are immunocompromised or medically vulnerable. It's a really difficult decision and very personal to us. And I'm still not entirely sure that this was the right thing. However, given that things are kind of indefinite at this point, you know, there isn't a clear end date. It's not like we can say, oh, by June, everything's going to be fine, in which case, sure, we can keep a mask for 3 more months. But I can't keep my 4-year-old masked in perpetuity. I can't keep my almost 2-year-old away from other social activities in perpetuity. And so that's why we made the decision that we did. Although I also fully respect other families that will make a very different decision from ours.
Dr. Leana Wen, this has been so informative, so incredible. I wish that everybody in the focus groups could get to talk to you, because I think it would be of enormous benefit. But thank you so much for joining us.
Thank you, Sarah. It was a pleasure. Thank you for the work that you do.
Bye-bye.
Hey, it's Rich Eisen, and my first guest of season 3 of Just Getting Started happens to be the new host of this podcast, my better half, Susie Schuster. You've got one of the most unique stories of how you got started, so why don't you come across the hall, take the chair, and oh boy, wait a minute, I think I locked the door. That's not a metaphor for anything.
How's the lighting in here? I mean, I'm vain, you know? So I thought for the first season, try to bring you people I thought were diverse and different and maybe interesting, and that's why I started off with Jeffrey Ross, the comedian. And then, you know, we've got a bunch of other asks out, making Paul Rudd do it. Sorry, Paul, do you know that you're doing it? And I want this to be inspirational. Life is really hard right now, and sometimes you just need a little bit of help, someone to reach out their hand and pull you along, or to push you from behind and say, you can do this. And I'm hoping that's what you're going to get from Just Getting Started.
Go follow Just Getting Started wherever you get your favorite shows.
Get an inside look at Hollywood with Michael Rosenbaum.
Let's get inside of Kristen Krug. You would do anything if you love the role.
If it was healthy, I would never want to hurt myself for a role.
Because there's some roles, there's like that guy on Walking Dead, they say he didn't shower a lot, he smelled on set. He wanted to be that kind of character. Could you see yourself doing that?
What's the point? Isn't that what makeup's for?
Inside of You with Michael Rosenbaum. Listen wherever you get your podcasts.